One of the things I see Dr. Walsh has already assumed the position. I appreciate you being here. First of all, I just want to share that my concerns relating to this item are based on a personally held philosophy, not in personalities or on individuals. So I want to say that right up front, because I think reasonable people will agree to disagree on this item. When I first heard about an MOU between the school district and the health department to provide the Tdap vaccine, initially I thought it sounded like a great idea. Great, we're working together. We always like collaboration. The more I learned about it and thought about how did we actually get to this place, what was the need that was expressed, that we somehow have decided, hey, we need to start mass vaccinating or give the option to parents to mass vaccinate sixth graders with the Tdap. So I guess I'd like to start by just asking that question. Who identified this as a need for us to do this at our schools?
Okay. Well, the identification of the need was when it went into law that seventh grade students needed to have the Tdap prior to starting school. And so that was the first, that making it available was a consideration.
I guess, and let me clarify my question. Who identified the need that we would need to have it at our schools? Because obviously, students get vaccines all the time without Seminole County Public Schools being involved.
Well, in previous years, the health department would bring the staff to a few designated middle schools and provide free Tdap at the school during the school day. What ended up happening, and after hours, so they would present it and provide it for families and make it accessible and free for the students to receive the Tdap. With the change in their staffing, there were some changes that they needed to make, and they did have an agreement made with Healthy Schools. We had an agreement with the health department because we work in conjunction with them for a lot of things that were required by state statute to deliver. And so we've always had an agreement with the health department. The health department then made an agreement with Healthy Schools. Now, I have some individuals here, if you have some specific questions that you would like to ask them.
I have lots of questions.
Okay.
So we'll get there.
All right.
Okay. So, all right, so the health department had a change in their funding and in their staffing, which then brought them to the place where they could no longer provide the service that they had been providing.
That is my understanding.
Okay. So, and from the numbers that I was given, there were 570 students that were seen by the health department to get their Tdap vaccine last year.
That is correct.
Okay. So 570 out of roughly 3,000 students that would have needed to have it, or
last
5,000-ish? 5,000?
Yes, ma'am.
Okay. So, and I'm doing round numbers here.
Okay.
So about 10%, let's say, of the students who needed the Tdap got it at the health department last year. And my question would have been, how many of those students would already be clients of the health department? They're receiving their care for any vaccine or any issue at the health department.
Well, they'll be able to answer the specific, but I did bring some information regarding how many students during scheduled pickup that did not have their Tdap. That's the week right before school starts. Right. So we have roughly 5,000 students in August that was registered in Seminole County Public Schools. We had 1,505 students that did not have their Tdap on the day of scheduled pickup, and we're not able to give them their schedules. So from the time that there was scheduled pickup to the time that the first day of school started, there was a mass exodus. So some of the students went to providers, their doctors, and some of them did go to the health department. And those, I believe, are the 570, but right. They can identify and say, are those regular clients or not? They can they can specify that.
Right.
So we did have that period. On the first day of school, we still had 249 seventh graders that did not have TDAP.
Right.
So that's last year's data that gave us
Right.
something
Yeah.
to share.
Absolutely. So, so the 249, and I understand the 1,500 is annoying to a parent because you went to pick up your schedule and you realized, oh shoot, I didn't have this vaccine done, and then they went and they got it done. 1,000 of them roughly to private providers, we would assume, and the other 500 and change to the health department. And the health department is now saying basically, we don't have the resources to care for all of those students anymore. So instead of addressing the 500 and change that we were doing, now instead, School Board of Seminole County, what we'd like to do is have access to all of your sixth graders before the end of the school year. We now want to have the opportunity to vaccinate 309 sixth graders. Mm-hmm. So we took a population of need of 500, and the way that we're going to address that need is by trying to vaccinate all 3,000 that still require the TDAP in sixth grade before they get to seventh grade. So for me, mm-hmm. from a philosophical perspective,
okay.
We could probably look, and then one of my questions was, how has the health department reached out to other local providers to help address those 500 students? Because that's really where the need is, mm-hmm. from the health department's perspective. After talking to a local provider, a pediatrician, and an office manager of another practice, my initial concerns were from a financial perspective. What is it that we're doing to our local providers who are parts of this community and who give to our community by now taking potentially those 3,000 sixth graders and vaccinating them at our schools so that they now most likely will not have, they won't have the, not the need, because they still have the need, but they won't have the requirement to go into their primary care or their pediatrician at that point for their physical or to talk about a meningitis vaccine, because the requirement will already be taken care of at our public schools. So in talking to the provider and the manager of the practice, their concern, while they said it would in fact impact them financially, was more of a continuity of care issue. There's a lot that happens at that visit with a pediatrician in that sixth grade to seventh grade time frame. You're getting physicals, you are getting counsel on whether or not to get a meningitis vaccine or other vaccinations. I'm concerned that we as a governmental entity are stepping in to provide something that we are creeping into an area of crossing the line of government taking parent responsibility. Those 3,309 sixth graders who still need the TDAP, most of them are still going to be going to their private physician with their parents, unless they get this nifty little flyer that mom sees that comes home that says, hey, you know what? We're just going to do that at school for you. Now you don't have to worry about it because now your requirement for seventh grade is taken care of. I mean, I don't know about you, but you're a busy mom, fabulous, deal with that. You're not going to make that appointment with your primary care or with your pediatrician over the summer then. And what type of care then has been overlooked for that child? My other little piece that I'm a little, I think is fabulous, I wish I'd thought of the business model myself. You know, I asked Dr. Walsh, I said, you know, how much is this company making on this endeavor? And she said, oh, they're not making any money. They're doing this for free. And it's true that there's no cost to the district, but when these students fill out this form and they take it home to get permission to get the vaccine, those with insurance coverage put in their insurance information. So the company is submitting for insurance reimbursement for all of these students who have insurance coverage, and then, of course, not charging for those who don't. So it's a fabulous deal for the health department because now they don't have to provide the staffing. It's a fabulous deal for the company because they now have access to 3,000 some odd customers that they didn't have before and revenue from insurance reimbursements. Meanwhile, our local providers who are a part of this community have just taken a little bit of a hit, and our kids don't have the continuity of care that they would have probably had. So that's my spiel in a nutshell, and I'm sure you all have questions, and I appreciate folks being here, but that's where I'm coming from.
Ms. Almond.
I don't have a question, I have a comment. I'd have driven across the country to take my child to my own pediatrician. They could pay me to give the shot at school, and I would never have changed. So I'm sure there are some people that might take advantage of that, but I trusted that person with my child's health. I would never have taken that option.
Well, and if we look at the numbers, because, you know, coming from the medical field, I'm very passionate about more now than ever before continuity of care. And you're correct, especially the middle school years. There's so much more than just the TDAP. There's a lot of important questions. There's a lot of assessments that need to be done and to be preventative maintenance rather than dealing with the crisis later in healthcare. And if I look at your rounded numbers, so if we're looking at 3339 and 1,500 didn't get the TDAP, so that's about, let's say, half.
In time for schedule pickup.
Right, in time for schedule pickup. As much as I would like to think that all of those families would have taken their child every single year for a physical like we have, if you look at our population of about 50% on free and reduced lunch, I would think some of those families are not doing that. So it's an option, but I agree with you that really we're using a sledgehammer when perhaps we could use a feather, that maybe we just need to offer opportunities for the smaller population that we know that doesn't access healthcare services elsewhere. Because it's very, very important, even though we've gone electronic records in our wonderful healthcare system that we have now, if you don't have access to it, which it doesn't sound like this would have, you might not ask that follow-up question of a medical issue that the child had the year before. And I know, for one, if I know the vaccine is taken, I'm going to keep delaying that physical too, because that would be one more schedule that I'd have to make. So I don't know if we've done everything we could to be proactive in the communication, because as you say, I think a group of these people for schedule pickup just absolutely forgot about it. If you come with a family with 2 working parents and it's just one, we heard it in our insurance committee even with our own employees, that when it came around for their wellness visit, they just ran out of time in the calendar year, that maybe we didn't communicate that effectively enough. And we know the percentage of our population that's transient in nature as well, and if they're coming from a different state, or God knows how many different countries we have coming in on an annual basis, they wouldn't know about the rules either. So I don't know if we've investigated every kind of communication before we, and I did not know about that last step of taking all the insurance information. I'm just really worried about data mining or sharing information on our students. So,
well, the parents have to fill it in.
right, but if it's on a piece of paper, it's not electronic. I'll confess, my children's backpacks weren't the cleanest things, that I don't know how much our staff would have to pick up of additional work with those forms and the security to make sure both FERPA and HIPAA are in compliance.
Did you want me to address a couple of things that you brought up?
Sure.
First of all, the communication that is being done. The CDC has done a good job of notifying the Florida Health Department, and we've done a good job of notifying our families as best we can to make sure their child is immunized before they enter 7th grade. They can get immunized at 11 years old, but some of them wait. You know, a lot of 11-year-olds turn in 6th grade, so they wait until we're forcing the issue, you know, so to speak. And so the health provider piece of it, that was another thing. Are we communicating that? When we hand out this opt-in form and the consent paperwork, in that letter that we send home to the parent, it really is encouraging parents to go to their pediatrician or their family provider, first and foremost, because they would have the history of the student and they would have some information that no one other person would know. This is an opportunity to provide immunization, vaccination for students that may not have that taken care of prior to the first day of school. I do have a couple individuals here. One representative, Tony Baselli, he is the co-founder of the Healthy Schools, and he's willing to go ahead and speak on any questions you might have there. I also have two representatives from the health department, Ms. Donna Walsh and her sidekick Gigi. So if you would like, they can come up and address those questions, because a lot of the data that we know to be true right now has been provided for you all.
So I guess one of my questions to my fellow board members would be, which vaccines and at what point does the school district feel that we need to start allowing to be administered in our schools? Where does, if Tdap, I mean, of course we got flu mist thing going on there, and I'm going to reserve comment on that, but so we feel like we need to do flu mist, and now we feel like we need to be involved in Tdap. So which vaccine are we going to start doing next? And this is not an anti-vaccine speech. I'm not gonna give an opinion on that one way or the other, but at some point in time, we could be on a slippery slope, because actually it was in a conversation with Gigi on the phone the other day, and I very sarcastically, you couldn't read my sarcasm over Ma Bell, but I very sarcastically said, well, Gigi, that sounds great. Why don't we just vaccinate the kids for everything at all the schools? And she said, yeah, that'd be great. No, okay, I was being sarcastic. There's a slippery slope here, and we as government, I think, need to be very aware when we're starting to slide down it.
Okay, who would like to address some of the comments that were shared?
So thank you. My name is Tony Baselli. I'm the president and founder of Healthy Schools, and just to address some of the issues, they're very good questions and comments from everybody. Us providing TDAPs actually arose out of school districts and health departments asking us to come provide this service because of the gap in care. The reality is, in the numbers that you brought up, that 1,500 kids, or 3,000 children at this point, do not have received the mandatory Tdap vaccine. Is interesting because it's an 11-year-old vaccine, so that means they've had over 12 months, sometimes 18 months by the time we offer it at the end of May to receive it. And you're exactly right, the continuous of care is important, and that's why we put in the letter, please go see it actually acts as a reminder at our cost, we pay for the printing, to tell the parents, go to your pediatrician to get this done, because that's where it should be done. The reality is, in today's healthcare, especially with the Medicaid population and the uninsured population, those opportunities often aren't. You can talk to health departments around the state. Several times parents have to go to the health department or other places, minute clinics and places, because one, their pediatrician is too busy, two, they might not have the transportation, or three, they might not be carrying the Tdap in inventory. And so really what we have seen in doing this around the state when it comes to Tdap is we don't nowhere near see the numbers. In fact, whether we make money or not on Tdap is a coin flip, because if 3,000 kids came, we would make money. But the reality is what happens is this notification actually reminds parents, and we see a much lower participation, which really ends up being about the number, about that 500 number that end up taking advantage of it, that end up not getting it done. And what it does for the school district, it allows that scheduled pickup in that first day of school, the 249 that missed school last year, not to miss school. And so there's less time away from learning, and obviously seat time is very important. The other thing that I think we provide that is lost sometimes is there's a high population in Florida, unfortunately, that have no insurance. And we do those no cost to those children and provide that service to them. In a perfect world, would we love to be able to offer all these things and continuous care? Absolutely. It's not perfect by any means, but we're trying to do the best we can and serve the greatest good to those children that either don't have an opportunity to go to their pediatrician because of the family dynamics, or for whatever reason that they don't, and we're just filling the gap in care for those individuals. So I would highly doubt the number of 3,000 that you have, we would see those kids. The majority of kids, like I think one of the board members said, their parents will get this as a reminder, remember to do it, and go to their pediatrician to get it done. So it serves as another reminder and to help the school district on the first day and to fill the need of a budget cuts that the health departments around the state of Florida have felt.
So I have a follow-up question for folks from the health department. So recognizing that your budget was declining and you were going to need to find some way to get some of those clients care in some other fashion, did you reach out to Shepherd's Hope or one of our local Physicians Associates groups, somebody local? Who did we contact locally about this? Or was the first thought to pick up the phone and call the guy in Jacksonville?
Actually, every year, and I've been in public health for 29 years, and I do have a nursing background, and have been involved in our back-to-school rushes, if you will, where parents come in a panic because they either can't get timely appointments with their providers, they're pressed for getting their children enrolled in school in a timely manner. We certainly could continue to provide the services through our health department as we have every year during the summer, making accommodations, extending our hours, and so forth. This was really, honestly, just an attempt to try to reduce the barriers for parents and to provide other options to care. We certainly by no means are discouraging them from going to their private providers. In fact, we're not considered a medical home. We don't have a pediatric clinic any longer at the health department because of reduction in funding through the health departments. So we did do studies throughout the county to find out how many pediatricians are available. And we realized that we no longer needed to provide the pediatric services. We do provide school physicals, of course, but we are not considered a medical home, so we're not trying to take business away from providers. Sure. Shepherd's Hope has their burdens. You know, we speak with them routinely with the clients that they're seeing. They are very short-staffed, so we knew basically that to approach them, to ask them to do what Healthy Schools is doing. They're unique in their services. Honestly, we don't see that that's a viable option for them to come into the schools. They can barely take care of the clients that they're seeing now at their location. So, so our intent was to provide options for parents, access to care. And our messaging every year, we do this through press releases, through notification. Gigi works very closely, as you know, with the school board nurses to get information out to parents well in advance of the enrollment for the coming year to get parents to go to their pediatricians, encouraging them to make those appointments and going ahead and get their vaccines updated in their school physicals.
So a couple things. One is I'm concerned that those 3,000 students obviously haven't been to a physician in over a year. So they haven't, which means they probably need to be going to one.
Correct.
Which means if we're going to offer those kids a vaccine that will be a Band-Aid, then the need to go see the physician has now been negated because it's been taken care of. So I don't think that that's helping us in our goal to get the kids.
Well, we truly educate them as well. It's not just giving them a vaccine, but it's educating them on the importance of
You're
making that
educating
appointment.
a 12-year-old child. The parent is not there.
Well,
So
the
any-
education is within the document sent home to the parents that the parent completes. So that's where the education comes into the parent.
Okay, that is in no way, shape, or form anywhere near sitting down with a doctor and talking about your child's medical history and having a conversation with a physician. Reading a piece of paper is not, that's not working. I just, I've made my thoughts known. I would like very much as a school board to look at the need and see how we can work with someone like Shepherd's Hope, perhaps to help with funding or some other type of resources to make sure that these students that obviously have gaps in care because they've not been seen by a physician, let's get them in some type of program, group, doctors. We all know plenty of doctors. If there is a real need in this community, then you all know that we can figure out a way to fulfill a need. Talking to the biggest need filler of them all with Dee Dee Schaffner. This to me is not solving a problem as much as it is perhaps creating another one. I'm also not clear on what happens when a student has a reaction at school. So you give them the Tdap, they go back to class, they have a reaction. They're not at home with mom. Now Mrs. Smith has a kid having a reaction in her class. Not to mention the fact that we've just disrupted our schools for 3 hours to have this coming and going thing going on, the added paperwork with the front office, people keeping track, the HIPAA, the whatever. To me, we've borrowed trouble where we didn't need it. Let's focus on the problem and fix the problem if we need to do that, but this is a sledgehammer.
Mr. Bauer.
It seems to me, let me ask this question to the superintendent. This is tetanus and diphtheria. What other requirements do we have with respect to vaccination?
It's just this particular one for middle school. In order for students to get their 7th grade schedule and start in 7th grade, they have to have a TDAP.
I have a whole list.
From my perspective, this is kind of equivalent to the physical I got to play baseball when I went to Lake Howell. It was a $10 physical. It involved basically checking me for hernia, coughing. There was no EKG done, sudden cardiac death. You all are aware that that's a leading killer of young athletes. Nothing that would detect that. I got a $10 physical so I could play. So from my perspective, if we're requiring certain vaccinations, anything that makes that more convenient for the parents to get the kids vaccinated, that's not a bad thing. If that's what we require. Now that's a different discussion.
Mr. Bauer, it's a state requirement. It actually started when I was a middle school principal in the late 90s, where the students had to have the TDAP. And I can tell you, hopefully the situation has gotten better, but it was a madhouse, that scheduled pickup. The number of families didn't know, and now I think the community has gotten accustomed to the fact that the kids, but these are still pretty large numbers for this many years later.
And I remember the first day of school, students coming on the bus.
Right.
They didn't have their shot, so they were all sent to the media center, and their parents were called to come and get them, which was very disruptive, no question about it. And Mr. Bauer, I agree with you. I think that if we can do anything to help the convenience of the parents with this.
It's our requirement.
It's a requirement. It's not our requirement. It's a state requirement, right, Mrs. Walsh?
That's correct.
Yeah. So I hear where you're coming from, Member Lockhart, but I feel like this is a service that can be provided in our schools to help kids. I don't feel like a place like Shepherd's Hope or another, I don't think they could handle anything like this. They're pretty well overwhelmed as they are. I hear what you're saying, and I certainly am not trying to undermine our local providers without any question whatsoever, but I feel like because it's a state requirement and kids can't go to school without it, that if we can help provide some opportunity for kids to get their shots at school, mom and dad have to fill out the paperwork. It's not like we're doing it without their knowledge. Then I feel like it's a service that we're providing for our kids.
So which other vaccines would you like to offer at schools as a service to parents?
None.
But that's where I have the problem, because are we starting down a slippery slope? Because as we all know very clearly, a lot of the rules that we must follow are not local in nature.
That's right.
And this is just one of many. And this board has been very strong in its voice against many other mandates put onto this school district that we didn't agree with. But my concern is, and I guess I need to know more about the healthy schools business. I mean, how many school districts do you have in Florida? Do you do it nationwide? Obviously, you're not a nonprofit organization, so when you came and said, yeah, you don't charge for homeless children.
No, we don't charge for any child who has no insurance, is what I said. So if they have no insurance, we don't charge anything for them.
Understood.
We're in 10 other school districts in the state of Florida. That more than that, other services, but that provide TDAP in those services.
And what are your other services that you provide in school districts?
We provide. There's a big gap in care for the Medicaid population when it comes to full physicals. It's not a mandatory by the state for school, but it's something that the state in the Medicaid plans and ACA, the state that wants the continuance of care for every adolescent who has Medicaid to receive a physical, and they're only seeing about a 30% compliance, so 30 to 40%. So you're seeing vast majorities of kids not seeing the doctor, which goes into why they're not getting the TDAP as well. And they receive the TDAP in so many different ways. It's not just the health department, maybe minute clinics or, the quick place. So the continuous of care, where that is the perfect world model, it does not happen, especially with the Medicaid population. And so we provide, so that's one of the other services we provide here in the state of Florida. In Texas, meningitis is a mandatory vaccine. So the only mandatory one here in Florida is Tdap. And Texas also has a mandatory for meningitis for 6th graders to get in 7th grade. So we provide that there as well. So the vaccines at this time of year, it's only Tdap in Florida because that's the only one that's mandatory by the state.
Dr. Griffin, don't we have mandatory in elementary?
To get into school,
Yeah.
before they go into school, there's a bunch of other ones, but we don't, we're not, those are kids who either go to the health department, they're not in school yet. These kids are already in school, and that's why we work with them. And then, so it's 10 others in Tdap in the state.
I want to be sure I have my figures correct. 1505 came to pick up schedules with no shots, right? Is that right?
Yes.
Okay.
That is last school year, yes, ma'am.
But you actually gave 570 shots, right?
So the health department gave 570 shots from the time, during the summer time frame prior to the school year starting. So of those 1,500, about 900 went to private providers.
That's my point.
Or, well, let's take away 250. Okay, so 700 students ended up going to another provider. 250 came without a Tdap. The 1,505 that we had to turn away, the majority of them found a way to get the Tdap.
Okay. So the first day of school, we had 250.
We had 249, but I'm rounding up.
49. I'm rounding
Yeah.
up too.
But how many of those students might have been newly enrolled to this district and weren't here, or like they're new to the state of Florida? How many of those 249 that showed up on the first day of school didn't? Because we had an uptick in enrollment last year.
I thought you would ask the question. And actually, we had 4,000, almost 5,000 students that were enrolled. We took the number of students that were enrolled already,
Okay.
and then looked at the students that were supposed to receive a schedule. We didn't even count any of the students that hadn't received enrollment paperwork or not enrolled.
Okay.
They weren't in the equation.
Okay.
So there were a lot of other students that might be new to Florida or new to our area that still didn't get their shots taken care of.
Okay. So in the perfect world of Healthy Schools LLC, what would you like to offer Seminole County students next?
Nothing. I mean, whatever the way our model has worked is we have gone by the demand of either the school district and a lot of times the health department, because under Florida state statute, they work together in a lot of health issues. And so we work with them, and Tdap actually arose because of a Florida district asking us to do it. And so we have a major problem on the first day of school, and it's very disruptive. The health department's overwhelmed, and can you come help serve this to the kids? So whatever the school districts around Florida ask us to do, that's our model. We'll come in and find a system that works to provide care, to provide that gap in care that is currently there around the state of Florida.
How many years have you been in business?
This next school year will be our 4th year.
And have you ever had any students with a bad reaction?
We've never had any, I don't want to say any, we might have had a student, sometimes the adolescent males have had, I think 1 or 2 might have fainted when they saw the needle. But our staff is trained. They're all registered nurses. They're trained in emergency protocol. They have everything at their disposal, including an EpiPen if there was some sort of reaction. So they're all certified, registered nurses. But we've had no major adverse reaction where there's been an issue around Tdap.
Board members, I have to disclose that I had a child that does have a major reaction with this, and I had to get a leniency every year to not have it done. So it does happen.
Oh, absolutely. And that's why we send the consent form with the medical questions that are reviewed by our medical staff to make sure that the right care is given to the right child.
Did you know, Dr. Calhoun, before he got his shot, that this was going to be an issue?
No.
So it came as a surprise.
Yes.
That's why it's important to have our hands there.
It didn't happen immediately. It takes.
It was later.
I mean, I had to watch him for 24 hours before the pediatrician would do something.
Yeah, typically, the protocol is to keep a kid in care, and what your pediatrician would do if the child goes to a pediatrician, about a 10-minute period to make sure that there's no adverse reaction. And the way that the clinics are set up, those children stay there, our registered nurses monitor them, make sure they're okay, and are safe to return back to class.
In theory, I want to make it as easy as possible for our parents to get their child enrolled in class because we know learning occurs when the child is in the classroom. And if it's going to require a parent to take the child away from a whole day of school to go to the pediatrician, that's not a good thing, right? But then on the other hand, are we creating a business model for a for-profit company to use our footprint without paying rent, you know, without having overhead to utilize our facilities for their company sustainability? I'm not saying Healthy Schools has that business model, but you know, there could be ABC Corporation saying, well, maybe they'll let us in because it's good for the children, because this board always makes our votes on what's best for our students. But we know that there's this fine line between a hand up and a hand out, and when people start expecting things, and if we offer it one year and pull it back in the next year, the numbers could grow. So I just think.
One of the things that we keep having discussions about as a board is personal responsibility for, and with our employees, you know, talking about this new model that we're trying to work toward a more consumer mindset of taking ownership of your health. This, to me, completely is diametrically opposed to that message that we've been giving our employees. We've been talking about continuity of care, and we want you to go have physicals, and we want you to have, you know, this is not helping these 249 the first day of school. It's not helping those 249 families, there may be some twins in there, to make better choices in the future. This is putting a Band-Aid on it. And I would rather have had an opportunity to work with the health department on a more holistic approach for Seminole County, using Seminole County folks. Maybe it's not Shepherd's Hope, that was just an example. Maybe it's Physicians Associates, Orlando Health. We have a lot of great conversations with them. Have we even presented this as a need to them? Are there creative ways that we could work with them?
Could we put it out in an RFP?
Well, that was one of my questions that I had, and actually I talked with Mr. Kelly about this, and he reminded me that because there is actually no fee for service, it is not a legal requirement to go out to RFP, but one could make the argument that you are giving someone something of value for their business without there being any competitive process.
Well, I know Orlando Health, and quite frankly, all the hospitals in this area have a great relationship with the school district. And we know we have employees that utilize their services, as do parents and families. And I remember, I think it was last year or the year before, when we working with our employees to get the physicals, Orlando Health did extend the hours of all of their general practice physicians to be able to accommodate our staff after school hours and right before the wellness deadline occurred. So that could be an option. And Mr. Bauer, believe it or not, they still do those same baseball, golf, football physicals in the high schools.
And I know because now as an adult, I don't get that 5-minute physical anymore. I hook up wires.
They want to know a whole lot more now, don't
Right, exactly. But my point being, in bringing up the physicals, was that was a profit stream for a lot of local providers.
Absolutely.
You know, they charge $10, but it takes 2 minutes.
Right.
You know, and from my perspective, making it convenient, if the state has a requirement that you have to do this to go to school, making it convenient, I don't care whether, if a company makes money, that's not I don't care. That's good for them. If they're giving us a service and giving us value that is important for us in making sure that our children have every opportunity, and I don't want to be a parent either. That's not my goal is not to, if if you want to provide a teachable moment and provide them with literature of local providers and information on gaps of care and how that affects health, that's great. Do it. Yeah, I'm all for that. But I do believe that giving certain families the opportunity to get this done in an easy, convenient way is probably a good thing.
But, and I go back to our 49% of kids that are on free and reduced lunch. I'm afraid they're the ones that are going to miss out if we don't have an opportunity for them to get it.
Let me ask this, if I can. What does this shot cost if you go to a local provider? I mean, what is a pediatrician going to charge you for this?
Depends. 30.
Typically under the Affordable Care Act, preventive medicine is 100% covered. So whatever the contract the individual provider has with the individual insurance company, and that varies. Florida Medicaid.
No, but say I don't have insurance and I just want to pay cash.
A lot of pediatricians won't see you if you don't have insurance. So typically, if you don't have insurance, you'd go to the health department, or you'd have to go to one of those standalone clinics.
Box.
Yeah, and what they charge, I'm not sure with the Tdap. It would probably be, I think the cost of a Tdap shot is in the high 20s, low 30s just for the shot itself before you pay for anything else. So I'm not sure what those people would charge for the uninsured population.
So let's just clarify, though, because I think I heard, I want to make sure I understood what you said, Mr. Bauer. Your perception is that we are currently not offering these parents the opportunity, or these students the opportunity to have this vaccine. And we are. The health department has been at the schools for how many years you've been providing this, to give this vaccine?
They've been provided for the district, the county, for decades, but or so with the inception of the Tdap. But as far as offering at the school level, I do remember my school was a site, and that was for 4 years, but that stopped 2 years ago.
Okay, so this is something that the health department has been offering, that we have been in conjunction with the health department offering as a service to our families for many years, for those who needed it, who weren't accessing other private resources available to them. Now, the health department, in a very creative way, is solving their need to still provide service to the community by doing it through this company. But I guarantee you the company is not going to say, yeah, let me just show up on the first day of school, and for those 249 students who don't have coverage, we're just going to give them those vaccines for free. That's not the deal. The deal is we want access to all of the sixth graders, because we want to be able to get the insurance reimbursement in order to offer the vaccine for free to those who don't have insurance. So it's their business model. Is it a bad model? No. Is it pretty darn smart? Yeah, I got to give you credit. Is it necessarily something that I think we want to do in Seminole County? No.
Every insurance company does it.
That's fine. My point is, did we go to our local providers where many of these children will have an opportunity to have a continuity of care
As a requirement,
first?
I have no problem. If you want to educate people about private alternatives, if you want to educate families as a part of the service, but to say that we're going to get rid of the opportunity for kids that may or may not have the resources to do this, or families that may or may not have the resources to do this, and the state still requires you to get the shot.
Right.
I mean, I don't see why you want to take away that convenience.
All right. Well, I think we've probably talked this to death, so I'll go ahead and call the question.
Is there a motion?
So moved.
On Dr. Griffin's recommendation, are you keeping your recommendation the same?
Yes, and I'll go ahead and repeat it. That the School Board of Seminole County approved a memorandum of understanding between the School Board of Seminole County, Florida, and the Florida Department of Health, Seminole County.
There's a motion. Is there a second? Is there any further discussion or questions? All those in favor signify by saying aye.
Aye.
All those opposed signify like sign. Aye.
Aye.
Ms. Schaffner, I didn't hear your vote.
I voted yes.
Okay.
I seconded.
Motion carries 3-2.
I have a question. Can I ask a question now? The gentleman. How much do you get reimbursed by Cigna or one of the insurance companies for this shot?
The actual, so our reimbursements goes throughout the board from the Florida Medicaid rate. The base rate of an admin is $10 if they have Medicaid, and it can go all the way up to, for Florida Blue, I believe, up to $25. The TDAP is an interesting vaccine because the way it's actually 3-in-1. And so I'd have to bring our billing people. So there's a different, you bill for it differently. You bill 2 different codes for it, but it also costs more to buy it than other vaccines. So if the question is whether we make money or not in what we're doing, and one of the board members alluded to that, our model existed because a lot of these type of programs that health departments around the country have been trying to do were dependent on grants and state dollars. And so we created a model that we hope can be sustainable because it accesses dollars that are already in the system through the insurance companies, Medicaid and private insurance, to pay for services that are 100% covered under ACA for children, for anyone with preventative care. And so we go provide those services. And so we are a for-profit company without a doubt. Is it as lucrative as maybe some of you think? Probably not, but that's neither here nor there. But I don't view it any different than several different service providers who provide services to the district, to students that are private companies. Maybe not Seminole County, I don't know the situation here, but around the state, there's private bus companies, there's private food vendors, there's private technology companies that provide services to school districts, to the students, to provide better services to those students for what they do. And that's how we view us. We're just trying to provide a service to the families and the students. So I hope that answers your question. It's a wide range. And I'm sorry I wasn't more specific.
Thank you.
Any other questions or comments, board members? No? Thank you all for being here this evening. We appreciate it. Dr. Griffin, do you have a recommendation for student discipline hearing disposition?
Yes, I do. That the School Board of Seminole County approved the student disciplinary recommendations for March 7th, 2016 and March 28th, 2016.
So moved.
Second.
There's a motion and a second. Any questions? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion